All right, thank you everybody for being here. My name is David Monias. I'm a Chief of the Nation for Pimicikamak, also known as Cross Lake First Nations of Banana Indians. We're located north of here, about 739 kilometers drive, or an hour and 15 minutes flying. Thank you for coming here. I just want to we wanted to bring us some serious concerns we have regarding the health system in our community. Where we come from, we have approximately over 10,000 plus citizens we have, and approximately 8,200 live on reserve and just off reserve there in the adjacent community of Cross Lake. And we have a nursing station. And right now we're supposed to have 13.5 nurses, and we currently have 6 doctors in there. And we have not been able to have any adequate nursing, and the nursing station had to be closed for emergency purposes. It's a concern to us because we feel that Canada, Health Canada, and Indigenous Service Canada, and even Manitoba are failing our people. For us, health is a treaty right, and we're entitled to these services. It's also a human right. And under the Canada Health Act, there's 5 pillars that are there, and we feel that they're being violated. There's accessibility. There's also portability of health services. There's universality, it's supposed to be, and then comprehensiveness, and also public administrative. We have issues regarding that because they're not being followed. We feel that Canada has a fiduciary obligation to make sure we receive these appropriate funding to get the adequate resources, right? And we feel that the closures of the nursing stations are a result of the shortage of nurses. And part of their strategies is actually bringing people from Philippines to hire paramedics to take over the role of nurses. But also we have private agencies providing services for our people. Yeah, they're supposed to be a public administrated entity. Right now we have problems where we have when nursing stations are closed, there's a phone triage. So before you even get to be seen at the nursing station, you have to phone in and you get triaged. And if you do get to be seen in the nursing station and you need to be medevaced and sent to the hospital in Winnipeg or Thompson, again, you have to be triaged by phone. And that means that the attending physician in one of those hospitals, if they have time for us, or if they feel that we should come in, then that's the only time the medevac will come in. But we feel that if you walk in, anybody walks into a hospital, you will be seen. You may wait, but you will be seen. We don't have that opportunity. For us, it's a human right that's being violated against our people. So we feel that there is a lot of systemic issues that are present in this whole system, and they seem to be more interested about fiscal compliance rather than on health and wellness being the priority for our people, to ensure that we have adequate services and people that we can count on in the community to come and provide services for us. And we feel that's not the way to go and deal with our health and wellness. You always get reports of our people dying 11 years younger than the general population. When I first became chief in my community, in our nation, there was 54 deaths, 2 by suicide, 4 by natural causes. And you can only assume that the rest were health related or medically related. So that means they're going to be preventable. So that contributes to that number. So we need to be adequately resourced and funded And we need to be involved in the recruitment of nurses, doctors, and developing our own health system. We're not ready to take over the health system because it's broken right now. It's a broken system. We don't want to be administering poverty to our people. But we want to be part of the solution and to be involved in decision making in recruitment. They're already employing private agencies to privatize nursing services. And those people, they don't have to come if they don't want to come. We have no control over them. So there's a lot of systemic issues that are inherent in that system that we need fixed. And we want the government to address it. I want to meet with the minister, even the prime minister, for both Canada and also the premier and the minister of health services for the province of Manitoba. We haven't had that done. That has not happened. We're one of the largest nations in Canada, First Nation, and we still feel that we're neglected. And we're going to be opening up a new health center. How are we going to staff that? You know, state-of-the-art building. Does that mean it's going to be a shortage of nurses and doctors? Are we going to have second-hand equipment? And not everything's going to be there. I'm going to ask my colleagues here. They'll introduce themselves. And I thank you again. And I'll be open for questions in a little bit once my colleagues here speak.
My name is Donnie McKay. I'm councillor responsible for health in my nation. And I've been in the health portfolio for the last 20 years now. So if I speak to something, it's like a broken record, and my health director can attest to that. So but I'm introducing myself at the moment. So let me say more.
My name is Brenda Frock. I'm a newly elected Executive Council member for Cross Lake, Pimicikamak. I also have a background in nursing. Currently, our nursing stations are complemented by nurses to help in the doctor service delivery model. Chronic nursing staffing and chronic shortage of nurses is negatively impacting patient care delivery in all our First Nations communities. Half of our population, or 25% of our population, is Cross Lake, have diabetes or pre-diabetes, with increased numbers of chronic kidney disease. The lack of commitment from the province of Manitoba to establish a renal health program or dialysis in our new health complex is a concern and an urgent need that needs to be addressed. Currently, we spend about $120,000 per patient per year to access care delivery in a city. Out of that $120,000, that includes hotel, meals, and transportation in city. And we have 27 patients who require dialysis in Cross Lake. So we need to address this chronic shortage of nursing urgently, and we need to meet with the province, Indigenous Service Canada, and Government of Canada urgently to address our needs, not just Cross Lake, but our other First Nations communities as well.
Thank you. So, I'm not sure if you want to add anything regarding dialysis and so forth.
Okay. Again, as my colleague stated, we have been after this dialysis renal program for the last 25 years, and the province has not responded or committed to any of these needs in our community. And, the epidemic of diabetes is there. There's no doubt about it. We need that renal program, especially in a community the size of ours. Any other nation or community in Manitoba, they have those dialysis renal programs. Yet, an indigenous community like ours with 10,000 people, there's nothing. And that's a serious, serious concern to us. And like my colleague stated, our people come out to the city or Thompson and they stay here. Just recently, my friend, he quit this treatment altogether because he was away from home. He can't be around his family. The families are separated. And he just took the bus with amputated legs. He rode for 13 hours, had to stay in Thompson the whole day. He even actually wheeled them to the highway to hitchhike. This is true. That's what our people do because they want to get home. They don't want to stay here, and they die from loneliness. That's the result of quitting their treatment. They're giving up their life to be with their families for a short period of time. That doesn't need to happen in our country. Canada has always boasted itself of being the third healthiest country in the world. But what do you see in our communities? I call that back alley medicine, medical care. It's outrageous. People shouldn't be able to live like that in Canada. They should never be able to live like that. Like the chief stated, the healthcare status in our communities is broken. It's a broken system. It's not the nurse's fault or the doctor's fault when something happens in our community. Because they're overburdened, they're overloaded, they're stressed out. And when you have those three symptoms of being overworked, then sometimes you tend to make mistakes. And that results in our people dying. So the system, I say, is killing our people.
Thank you, Tony. I think the main message is that also that we need to improve our health system. We need to be properly resourced and properly funded, and to be properly consulted. Because we are basically sick and tired of bringing our people home in a box. Because that's what it comes down to. So many unnecessary deaths that are happening there. They're preventable if we can treat them at home, if we can get to them early, and if we had the proper resources, we wouldn't have our people that are in a wheelchair with amputated legs hitchhiking home to be with their family. He's talking about a family member and a friend, but also one of our citizens that just recently died. He just had enough of the health system because it's not taking care of him. It's failing him. Councillor Donnie McKay talks about being a broken record, saying the same thing over and again. But he has to keep on saying this over and over and over again until some out there in the government listens and hears us and say, okay, we hear you. Let's do something about this. Let's not do a band-aid solution and come up with real danceable solutions. That's all we're after, is to make sure that our people are taken care of and health-wise, medically wise. Thank you.
So when I've done stories in the past about healthcare on reserve, there's a lot of passing the buck. The province goes, well, it's federal responsibility. And then, you know, the federal government says, oh, the province should follow up on this. And it's not clear, like, where should the support be coming from?
Well, right now, kind of like you said, we said that it's health is a treaty right. Canada has a fiduciary obligations, but they gave under Section 924 of the Constitution powers to the Manitoba for health services, and they're saying, well, that's not our responsibility. So, and if they're not wanting to take responsibility, then Canada has to step up and resource us properly and fund us properly so we can take care of our own people. If you know, before Europeans came, we had a health system. It was natural health system. We had sweats. The forest, the land, and the water was our medicine, our pharmacy. We had medicines there, and they come and destroy those things. And now they give us other medicines that are more addictive and destroying our people as well. That's not right. It doesn't make sense. When are they going to wake up?
And you spoke about a new health center. Like, what are the plans for opening that, and will dialysis be included at the health center?
Well, that's one of the things we've been asking for. He's been asking for a dialysis for how many years? He's been on the council for 20 years. We still don't have a dialysis machine. It's still not planned to be part of it. What we are asking for it. We've been lobbying the government for it and advocating for our citizens, and it's still not in there. Manitoba needs to step up and say, listen, we have a renal program. We'll bring it to Cross Lake. When we had last we did was 24 dialysis patients that were being transported back and forth to Thompson and Winnipeg. This was a few years ago. It was $2.7 million, and she's talking about the numbers here. 1.6 of that money was for transportation, accommodations, and meals. A dialysis was about, at that time, $1.3 million. That could have paid for it already. They wouldn't have to travel. And the rest was the money was at $1.1 million was on the technicians. That could have paid for a couple of technicians that could have worked there, or more. And a facility where you're going to be developed. It does not make financial sense. It does not make moral sense. It's not responsible delivery of services at all.
And the health center would be operated by Cross Lake Health Services? Or-
Yes, the health services that were, the health center is going to be open, grand opening will be on October 11th. We are inviting the minister, and hopefully we have a discussion before that time. And it's designed to hold about 255 staff. Right now we have about 52 to 55 staff in the nursing station. And now we're wondering, we're short of nurses and physicians and all healthcare staff. How are you going to do that? Bringing people from out of country is not going to work. She's a nurse. We have nurses from Cross Lake that are not being hired by Finney. They go somewhere else to be hired. It doesn't make sense. Like I said, it's not responsible.
So as a nurse working in Cross Lake and Pinnachickamack, I mean, what's it like being so understaffed and having all that need to deal with?
I just found out that we've had about 20 clinic closures. It was worse over the summer. They had about 5 to 7 nurses, but because of, understaffed, overworked, they have to be on call 24/7. Some of the nurses fell ill. So the numbers of the nurses numbers dropped to 4. So they're expected to work 24/7. So it has gotten worse. It's not getting any better. And we are burning out our nurses. They need better supports from Manitoba region. They need better supports from the agency nurses. As an agency nurse, you can only commit to come in 1 week or 2 weeks. It's up to the nurse, and there's no obligation to stay if there's a need. Sometimes nurses from Cross Lake are pulled to staff at their nursing stations that are facing possible closures. So it's a mess right now.
And does that make it even harder to recruit nurses from the community when they hear how hard it is to be a nurse?
It is very hard to recruit. We have huge number of First Nations nurses that are willing to come back to their communities to provide the care they needed. We have dialysis nurses from Cross Lake that are willing to come home and provide that service.
And how does it make you feel knowing that there's barriers to having them come back?
There's the jurisdiction barriers is the most frustrating part of nursing.
Exactly.
We know the need, we've been advocating for the need, but having no, either Indigenous Service Canada or province of Manitoba not able to commit the resources, it's very frustrating. And it's very hard on the patients and the families. Like Donnie said, the lifespan for a dialysis patient is very short. If you're diagnosed as a diabetic initially, and if you don't control your symptoms, if you don't control your blood sugar levels, in 10 years you're expected to have complications. And once you require dialysis, your lifespan is maybe about 6 years. And most of those 6 years when they're in dialysis, they live out of community. So they don't have the supports from the family, from the friends, and from the community. A lot of the dialysis patients come home. They skip dialysis just to be with family. Then they run into complications for not attending their dialysis. Then they become an urgent medevac out of Cross Lake or any other First Nations. And medevac is currently at about 5,000 per medevac per patient. And to date, we've had about 311 medevacs from Cross Lake from January. At 5,000, you do the math, it's quite alarming how much money we spend on medevacs. Just recently, over the weekend, we had 11 medevacs.
Yeah.
So
And were they mainly because of diabetes, or was it just a variety?
a variety.
And who operates the medevacs?
Provinces.
The province.
Yeah, they're responsible.
they
But
are
is the airline, is it Perimeter?
Oh, yeah.
Perimeter.
Yeah.
There's different airlines: Perimeter, Fast Air, Mississippi Air. So they're making lots of profit from these medevacs.
And I'll do a mic shift again unless somebody wants to ask a question of the nurse. Okay.
I'm gonna comment further on the jurisdiction.
Yeah, I was gonna get you to answer a question or two if you can. Just move this a little closer, thanks.
Brenda commented on the, you asked on the jurisdiction, or maybe more or less towards that, but yes, it is a very a messy issue for us, being throwing back and forth who's responsible for what. And, I stated one time with actually the news media at the time when we had our cluster of suicides and what, in there, I said, there should be no boundaries in health, for anyone. Not to be thrown back and forth between the province and the federal government. And when I said that, the same quote, Greg Sillinger quoted that when I said that there should be no boundaries. But Brenda knows all about jurisdiction and things like that, because that's what happens out there. That's how the game is being played, and we cannot live by that. It's very, it's detrimental, of course, to the overall health status of our nation, our people, and we have to go to a certain road to come to Winnipeg too. When you're talking about transportation, when there's a Medifax out of our community, it goes to Thompson. You know how much that plane costs? Plus they have to pay for the ambulance. And then from Thompson, when there's a lit, they have to get another charter to Winnipeg. Another expense there. We have provided solutions, but Health Canada doesn't want to listen. They don't want to heed how we protect our health status to be how we want it, like the chief said. We want to make our own decision making, how to run our own health status of our people, and that is a must in this health transformation that keeps popping up.
So when the health center opens up, do you think you won't have to medevac as many people?
Well, the chief stated exactly what's going on right now. There's a chronically shortage of nurses, and that's what's going to happen with our health center. It's going to be a white elephant. Who's going to be in there? 4 nurses? I don't think so. That's not going to work. So those are some of the things that we have to look at with Health Canada and the province. Like I said, we want a dialysis machine for our people. That is priority for the health center. We don't want our people going out of town to get traveled another 3 hours to Thompson to get their dialysis treatment. You know what a toll it takes on the health of that already sick person that who's going to be traveling up and down and bumping on that road.
What did your friend say about that? I'm sorry for your loss. What did your friend say about that, like the traveling and?
Oh no, he was just tired. He was tired, He was just tired of it, and a lot of the same thing. A lot of our people, our elders, they're sick. They're sick of it when they're already sick, So the province has to step up and get us that dialysis machine.
How does it make you feel knowing that the lack of dialysis machines in your community might have led to your friends' premature death?
It always breaks my heart, and it always breaks our chief and council's hearts to see our people, like Chief said, come back in a box instead of being in harmony with their health, or And these are getting younger and younger. My sister too. Same thing. She quit. She just quit and said, no more. I want to go home and be with my family. I want to be with my family even if I go pass away from this earth.
That must be terribly sad for your family.
Sad for everybody in the community, not for the family itself, because, So that's the system we have to live with. And those are the systems that we'd like to have, those diagnostic equipment, the adequate number of nurses in the community, the adequate number of doctors. So we need those things in place if we're going to truly have a health transformation. we have to have some kind of, some form of control, decision-making, how we should help our health status work for our people, because they're dying without those resources available.
And Chief Williams, you said you requested meetings with some of the federal and provincial leaders, is that right? Or?
We have called on the government to have a meeting with us. We haven't had a meeting with the Minister of Health for Manitoba at all. Even though they committed some funding for Northern Health programs. We had meetings with also with our own, the bureaucrats, but they're focused on saving money. And we need the proper authorities to be there to say to us, yeah, we're gonna fund you, we're gonna get you the good quality healthcare services. You got the building, we'll provide you with the adequate resources for the nurses, for the doctors, and also the point of care testing. We cannot have a state-of-the-art building with used equipment. And you must have point of care testing here, unless you're really good at seeing through people and see what's wrong with them. And doctors are good, but unless you have the lab technicians and unless you have the x-ray technicians, unless you have the people who run the EKGs and ultrasounds in the community, then you won't be testing.
Has Indigenous Services Canada weighed in on this at all? Or?
Well, we had a call from Indigenous Service Canada. Philip had called, and that they know about this press conference. But it shouldn't take a press conference for them to call me, right? It should be the actual concern for the health and well-being of our people. That should be a priority.
What did they say in that call?
Well, one of the things that they did say was that they're trying to get at 7 nurses for our community. We're entitled to 13.5, and they're going after 7? That's not even close enough for a community of 10,000 people. We actually need over 20 nurses in our community. Now, people think that may be lots, but it's not compared to the number of nurses that exist in Thompson. Our community is almost the size of Thompson, and they have all the hospitals, the nurses, the physicians, and the technicians, and so forth. We can't be treated any less than a human being, other human beings. It's just genocide continuing. And imagine you getting sick and you getting put in a hotel with 4 walls and no support systems, no family. You know, you get lonely too. And you probably want to go home, knowing that you probably die if you go home.
Currently, we have 1.5 public health nurses in Cross Lake, 8,000. So childhood and school elimination.
Sorry, can you start again? There we go.
We have 1.5 public health nurses in Cross Lake for a community of 8,000. So childhood, school immunization programs are behind. Our HIV numbers are increasing. Our syphilis rates are increasing as well. We have 1 prenatal nurse for Cross Lake, and we have increased syphilis rates in a pregnancy, and children, infants being born to syphilis positive moms. So we don't even know the extent of the complications these infants will have in the long term. So even those programs are lacking, and they are mandatory. So I just wanted to add on, it's just not the nursing delivery, it's public health, it's prenatal. Sometimes the nurse in charge, who is supposed to oversee the operation of the nursing station and review labs, he or she gets pulled to the floor to assist. So there's a high possibility that you can miss a critical result. And that's gonna affect the patient as well.
So it just seems like so many health problems are on the rise.
So many,
Health problems are just on the rise.
yes.
Well, not only health problem, people are dying,
Yeah.
literally, from lack of health care. And that's just not acceptable. I mean, people are dying in our community. Well, thank you for being here. Thank you so much.
Thank you.